It's not every day that the burns unit opens its doors, so I feel really, really privileged to have seen just a small part of the incredible work that they do there. And I'm really, really pleased to welcome here today to the show burns nurse Hana Menezes and acting commander of the CFA, Andrew Smith. Welcome. Now, Hana, when I was having a tour around the Alfred, I noticed that the patients were kept in their room, but then a lot of the treatments were happening elsewhere. Can you explain why that separation is so important?
Yeah, it's the patient's room's sort of considered a safe haven, a place that they can go back to and rest. So dressings, procedures and often therapy are done away from that area.
Okay.
Yeah.
And it gives them that peace of mind, doesn't it?
Yeah.
Where they can associate their room with peace and quiet,
Yep.
and anything else that might be quite traumatic is elsewhere.
That's right.
And I can't believe the remarkable work you do. I found that really confronting, to be honest with you, watching that that bit of vision. What are some of the worst examples you've had to deal with? You've been doing it for 13 years.
Yeah, I've been around burns for, well, nearly 20.
Yeah.
I worked in intensive care before and that's how I got my exposure to burns patients. It's not the size of injury for me, it's about the individual. Every patient's different. You know, that impact that it has on you as a person is sort of where it's at for me. And my job, I know I'll be done when it doesn't affect me in that way. It's that sort of personal impact that really touches your heart.
Hana, I noticed that you can take about, or there's an average of 9 patients in there at any one time.
Yep.
Can you tell me what some of the most common treatments are and what most of the common things that you're seeing in there?
Yeah, in terms of injury types?
Yeah.
So 60% of our patients have flame-related injury, and of that 60%, 88 of those are young men. So significant number of our patients, unfortunately, are males. We do often dressings, procedures, wound care, skin grafting, operating. It's quite variable depending on how big the burn is and what sort of treatment's needed.
We're seeing a lot of those developments now in skin grafting and new skin technology. What are some of the things being used now than, say, 10 years ago were unheard of?
Yeah, so biological dressings and bioengineered skin substitutes are the
They
big...
can mimic the skin.
Yeah, they can.
Yeah.
We've got a substitute that we're using at the moment that's purely polyurethane and there's no sort of biological component to that. Okay. So there's all sorts of different ranges of skin substitutes that we use. One of them's a pig collagen-based skin substitute, so it acts like a biological dressing and covers the wounds, dampens the pain response, improves healing times, gets people out of hospital quicker, minimises risk of infection.
And Andrew, you respond to house fires and, well, so much more than that. And so you're there, right, first response when someone has been burned, which I imagine is the crucial moment for them. How do you treat them while you're waiting for the ambulance?
Basically, it's no different than any normal first aid person would get the education on. We'd treat them with water, cold running water for 20 minutes. But the main thing is when we use the cold water on them, we're actually lowering their person's core body temperature. So we treat the patient by cooling the burn and warming the patient until the ambulance arrive, and then they can give further pain relief if that's required.
I imagine there's a huge need for comfort for that person
There
at
is.
that time.
yeah, because they're in shock and
Yes.
they don't know what's going on. They could be in a lot of pain, and we can only do so much until the ambulance arrive.
Right.
Yeah.
And now the CFA is working with the Royal Children's Hospital and the Alfred Hospital as well with a preventative program. Tell us about that.
Yeah, it's called the Victorian Burns Prevention Partnership. It started in about 2004 and we've been working together, and it's a bit unique. We were looking for some data in relation to people we were missing in the community, and we realised that there was a number of people getting burnt, particularly flame-related, from the Alfred Hospital. So it was a way of bringing the hospitals and the emergency services together to work on a burn prevention message out there to stop all the people getting burnt and stop them going to the basically putting Hana out of a job.
In a good way.
Yeah, in a good way. Yeah.
Coming back to you, Hana, we hear the term first, second, third degree burns a lot. Can you actually explain what that means?
I can, and it's often sort of a misunderstood terminology. In the States, they name it first, second, third degree. In Australia, we tend to name the layer of the skin that's been damaged. So epidermal burns are your true sort of sunburns. They're quite dry. and then you move into the dermal burns, and depending on which layer of the dermis has been damaged, depends on whether you need skin grafts, which is sort of like the ultimate gold standard surgery of skin replacement.
Andrew, can I ask, we were talking earlier about unattended home appliances. Obviously that's playing a huge part. Are we doing enough when it comes to fire safety, and what more could we be doing?
Just making sure that obviously smoke detectors have been a big asset to us in the community, and making sure that they work properly.
Yeah.
And also cooking or kitchens are a main source of where fires start. So making sure we haven't got unattended cooking, and we know what to do, and making sure that we've got a smoke detector, making sure that we've got fire blankets and a fire extinguisher in our home. And if you are cooking with oil, and we're hoping people don't, but if they are cooking with oil and it does catch fire, we encourage people not to pick the hot pot up that's on fire and try and take it outside. Hana sees the result of that at the hospital.
Andrew, Hannah, thanks so much for joining us in the House of Wellness and for the incredible life-saving work that you both do. We really appreciate it.
Thank you.
Thank you.
Up next, Rach gets a spellbinding workout from a so-called body magician. Looking forward to seeing this one. Can't wait for that, Rach. That's next on the House of Wellness.